training programs for various healthcare professionals for more than a decade now. Customized training programs are led across the country to bring about transformation in delivering patient care. Dr. Reddy's Foundation for Health Education has impacted more than 250,000 plus healthcare professionals till date, which includes 26,000 plus senior consultants, 138,000 plus nurses, more than 33,000 plus physicians, 17,000 plus pharmacists, and 13,000 plus postgraduate doctors. DRFHE has engaged 230,000 plus corporate employees on health awareness through Awareness for Life session till date. A warm welcome to all the participants for this session. Today's topic is on managing high blood pressure and hypertension during these challenging times. And to guide us on this, we have Dr. Praneeth Polamari. So Dr. Praneeth Polamari, he has done MBBS from Osmania Medical College, MD from Nizam's Institute of Medical Sciences, and a DM from Osmania Medical College. Currently, he is working as senior consultant cardiologist at Care Hospitals, Hyderabad. He is interested in complex coronary interventions like bifurcation lesions, CTO, etc. And he also have expertise in structural heart interventions, including TAVR. Without taking much time, I would like to hand it over to sir. I would request all the participants to post your questions in the chat window, and we'll be happy to take them at the end.
Kulkarni sir, before we go ahead, I would like to even speak a little words about our college.
Sure, please.
So in this noble journey, we have this eminent personality who has graced to share his experience and insights with us, Dr. Praneeth sir. And we are very happy to welcome you to VJIT, sir. Just telling a few words about VJIT, Vidya Institute of Technology, is accredited by NBA and NAC, is affiliated to JNQH and approved by AICTE. It is a premier engineering institute ranked as the 8th best engineering college by Time innovation and technology, along with focus on the all-round development for human welfare, for which we are continuously striving to improve. This can be affirmed with VJIT's evident and remarkable upcurve progress, marking a unique place for itself among the different colleges of Telangana. VJIT offers undergraduate engineering programs in civil, triple mechanical, ECE, CSE, IT, AI, and CSDS, and MTech and MBA in the postgraduate programs. I take the pleasure of welcoming the guest speaker of today's event, Dr. Praneeth. And I also welcome our director, Dr. Sai Baba Reddy, sir, Principal Dr. A. Padmaja ma'am, Senior AO, Mr. Chellam, Academic all the departments of VJIT. I also would like to welcome Ms. Lata Reddy and her team from Dr. Reddy's Foundation for Health Education, our faculty, students, and most importantly, the members who are joining the session. And of course, already Kulkarni sir has given a brief introduction of Praneeth sir. He has speaking a few words about Dr. Praneeth. He has many publications, and he was awarded as Vaidya Ratna Kakinada 2019 January, and by Mega City Navakala Vedika in 2019 in March. Sir, I welcome you to VJIT, and we are very honored to have you with us. Now the audience is all yours.
Good evening, everyone. Namaste, and thank you for that introduction. I am excited. I am honored to be associated with you all today, and I got an opportunity to share some of the knowledge or experience or whatever that I can say. And I equally thank Dr. Reddy's for arranging this meeting to get associated with all you people. So without taking much time, my agenda today is to talk about hypertension, try to kind of give you some information on hypertension and about answering few common questions about hypertension and how do we manage all. It's a very simple presentation that I would be more happy to answer your questions than boring you with my lecture on hypertension. But anyway, so we are in this challenging time dealing with COVID-19 pandemic and hypertension being one of the common diseases which most of them have. How do we manage is the essence of topic today. Few things about hypertension. Hypertension is said to be the so-called silent killer. Why is it said so? Because hypertension is something which damages almost any major organ in the body. Take it heart, brain, kidneys, or whatever. And because of the damage, consequently, it can end up having subsequent problems like you can have a brain stroke, you can have heart attack, patient can end up having a heart failure, kidney failure, eye damage, and whatnot. The most important thing here is the hypertension related organ damage that does not happen quickly. It happens over a slow period of time. The amount of damage is very subtle, very slow, and by the time we could realize that there is a problem, the damage has already occurred, and unfortunately, the damage is permanent. That is where we call it as a silent killer. If you look at the current status of there seems to be some crosstalk, so can someone please mute the other participants?
Sorry.
So regarding hypertension. Sorry.
Sir, you can carry on.
Yes, yes. So regarding the status of hypertension prevalence and incidence, so all across more than 50 million people are affected with hypertension, and in India, the incidence is almost 6 to 15% in about in Indian prevalence, and it is quite prevalent. And the most important thing that we need to know is most of the patients who do have hypertension, they do not know that they have hypertension. If you look at the WHO statistics, almost 1 in 4 people who have hypertension, they do not know. That is the sad part of it, and that is not realized. And taking about women, so patients in women also almost 1 in 5 have hypertension, and most of them don't know that they have hypertension. And this hypertension, because they don't know, this uncontrolled hypertension leads to organ damage slowly. And when we realize, they end up having organ dysfunction. And as I was saying, it's almost permanent. All these things is quite preventable and can be taken care of had we been recognizing it early and taking it under control early. So few things that we need to know is, first, what is blood pressure? So the most important thing, few basic information is about blood pressure. So heart is a pumping organ. It pumps blood to each every organ, and the blood flows through the narrow tubes inside human body. These we call as arteries. And the blood has to go and or has to flow, and it has to go with a pressure. And this is the pressure which is created by heart and the arterial blood vessel wall, when this is referred to as blood pressure. When we talk about blood pressure, there are two numbers which are commonly seen, and systolic blood pressure and diastolic blood pressure. Usually the upper reading is the systolic blood pressure and the lower reading is diastolic blood pressure. Both the numbers are equally important. So commonly asked question, what is normal blood pressure? We all know what is a normal blood pressure, because everyone have their own numbers and everyone have their own standards of calling themselves as having a normal blood pressure, but it isn't. And there is yes, thank you. So we all need to know what is the normal blood pressure readings. So the normal blood pressure, the layman term is 120/80, which is incorrect. Normal blood pressure, if you pay attention, is it should be less than 120 systolic blood pressure and less than 80 diastolic blood pressure. That is when it is said to be normal. And anything which is more than that is not normal. And depending on the severity or the degree of elevation, it's being staged. You can call it as an elevated blood pressure or a high blood pressure and hypertensive crisis, etc. and whatnot. The most important thing that we come across in our clinical practice is whenever patient has a blood pressure of 170, they say it is low BP, and people tend to panic that the blood pressure is low and they tend to stop taking medications, or they tend to get panicky, which is incorrect. So the normal blood pressure is said to be less than 120 and less than 80. And if you are having a blood pressure of 170, in fact, the blood pressure is under control, and please do not stop any medication. The other thing is then what is low BP, which again is commonly heard in a clinical practice. Low BP is something, technically we call it as a hypertension. So any blood pressure which is less than 90 systolic, that is the upper number, and something which is less than 60, which is the lower number, is sometimes considered hypertension. Again, these numbers are slightly variable because patients who have heart disease or something can sometimes have blood pressure less than this as well, and say still okay. But for today's discussion or today's topic of discussion, the thing that we need to carry home is blood pressure less than 120 and less than 80 is said to be normal, and anything above that is not normal. Yeah. And next question is, how do we check blood pressure? The most important thing is blood pressure. Nowadays, we have BP machines available at most of the places, and we tend to check blood pressure, particularly with the COVID time, where reaching medical facilities or hospitals or clinics is becoming challenging because of various concerns. It is recommended to have a blood machine of your own and keep monitoring your blood pressure. But having a BP machine at home and doing measurements, there are some things which we need to pay attention. So there are some rules that we need to follow. So first important thing is the position of the person who is getting his blood pressure checked. The most important thing, if we look at this picture, is the back has to be supported. So sitting on a stool or sitting on a sofa without the back not being supported is not recommended. So always the person has to be sitting comfortably. So the back has to be supported because there is no undue strain on the spine. The feet are supposed to be flat on the floor. There should not be any crossing of feet, and the feet should not be dangling at the edge of the chair. The feet should be firmly flat on the floor, and the back should be supported. The next important thing, the arm where the BP cuff machine is attached or tied to, that arm has also to be rested, and that arm has to be preferably rested at the edge of the table, or sometimes we can even take a measurement with supine position or lying down position. The things that we need to pay attention to is the room should be quiet. There should be comfortable temperature. No smoking, coffee, and exercise for the last 30 minutes, because these can lead to increase in blood pressure and give you a false reading. Again, a full bladder is something which can again lead to a blood pressure. So preferably go to washroom, empty your bladder, and get your blood pressure checked. After the BP cuff has been attached, relax for 3 to 5 minutes so that all that sympathetic drive or activities comes down and it can give an accurate measurement. It is always preferable to take multiple readings, because one reading may not give the accurate reading. And as the recommendations are to at least take 3 measurements with at least 1 minute gap between the measurements, and try to take an average of the last 2 measurements. While the BP machine is checking the blood pressure, please don't engage in conversation, do not talk, and be comfortable. The BP cuff, which is being tied to the arm, also has a bearing on the measurement. So the normally available BP cuff with its BP machine with its cuff comes as a medium-sized cuff, which is to most of the patients will be comfortable. Someone who is around 60-70 kg who have decent arm circumference, that cuff will be good enough. But some patients are too lean and some patients are obese, for whom this particular BP cuff may not be adequate. For someone who are lean, the cuff size has to be smaller, and someone who is obese, the cuff size has to be large. So depending on your arm circumference, the cuff size also needs to be adjusted, and it has to be paid attention. The BP machine which is being used has to be kind of standard. Most of the BP machines currently which are available decently do the good job. But if we still want to be very particular about what machine we are using and standard recommended, there is a website here mentioned, stridebp.org, which is a UK-based website where it lists all the approved BP machines, and you can look into that. And those machines which are available in India, we can get them. And the BP measurements which are taken, it is always recommended to have a recording, try to make a note of BP measurements, because whenever as a clinicians we want to manage hypertension, we do not want to make a decision based on one reading. We want to look at the trend of blood pressure over a period of time. So whenever you are checking blood pressure, please make a note of that weekly or monthly or whatever is comfortable for you. Make a note of your BP readings, and then we can act on those readings. Whenever BP has been checked and BP measure has been found to be elevated, when we discuss about that the possibility of having hypertension, the first question is, how can I have hypertension? I'm not one who can have hypertension. I'm chill, I'm cool, and how can I have blood pressure? And I'm too young to have blood pressure. These are the common questions. So that question, though looks relevant, equally the answer is something which is difficult to answer. The most important thing that we need to understand is anybody can have hypertension. It is only that we need to accept, because there are various factors or various risk factors which we can influence the diagnosis or presence of a hypertension. The commonly said things are both environmental factors and genetic factors, because of the family history or whatnot and the environment that we are living in. Inactivity, stress, smoking, obesity, salt intake, increasing age, alcohol consumption, etc. And compared to the gender, men are said to be having a higher risk of having hypertension compared to women, and all put together as a combination can influence or decide whether we can have hypertension or not. So the question of how can I have hypertension may not be always relevant, and we need to understand that because of various reasons, not in isolation, we can have hypertension. The other question which we commonly ask is, I don't have any symptoms, I don't experience anything, I don't have any headache, I don't get angry, I don't shout at people, and I'm cool. So why can I have blood pressure? How do I accept that I can have hypertension? The most important thing again that we need to understand is hypertension has no symptoms. So people only think that only when you are shouting or crazy or cranky is that when we have hypertension, but it is not. Hypertension per se doesn't have any symptoms, and if hypertension is having symptoms, that means that hypertension was long enough to produce some organ damage, and unfortunately we missed the bus. So we should not wait until we experience symptoms, and mere presence or mere absence of symptoms does not rule out the possibility that we do not have hypertension. So these are some things which we need to be very clear about hypertension. So once we understand that we can hypertension and without having any symptoms, and the ultimate thing that we need to accept is it's a lifelong disease. Once hypertension is there, it is a lifelong disease and it's going to be there for the rest of the life. It can only be controlled and it cannot be cured. So before labeling any patient as having hypertension, we want to make sure that the blood pressure measurements were taken accurately, multiple readings were taken, all the variable confounding factors which can lead to false elevation of blood pressure has been eliminated. And only then diagnosis of hypertension is made, and then it's an understanding between the patient and the physician that hypertension is now there, and it's a responsibility of the physician to make the patient understand that it is a lifelong disease and you need to accept the fact, and only then we can move forward. Unless we do not come to this step, then managing hypertension will be challenging and it will be difficult. So once we accept that we have hypertension, then the next step begins. The next step would be about managing hypertension. How do we manage hypertension? There is something called pharmacotherapy or drugs, and something which is beyond drug. Let's first discuss about what we can do, so which is not beyond medicines. First important thing for any person, the lifestyle modification are something which are recommended. And when we talk about lifestyle modification, which is boring to listen, but equally very important to understand, it has an impact. The excess salt intake, what we say, we all as Indians, be consuming a lot of salt. The average intake to be around 3 to 4 grams recommended, and an average Indian diet contains approximately 5 to 10 grams of salt on an average, and sometimes it can increase more when we consume those pickles and chutneys, etc. So try to pay attention to what we are eating, and if possible, try to limit the salt intake to less than 2 grams a day, because salt intake is said to be one of the important factors for hypertension and also in managing hypertension. Try to cook food with low salt and try to avoid salt sometimes. There are some practices of cooking rice with salt, and there's some tradition of adding salt in addition to what has been cooked. So these are some of the practices which needs to pay attention, and if possible, try to reduce the amount of salt intake. And all those high salt intake foods like chips, papads, pickles, all those preserved foods, because to preserve we need high salt. So all those preserved foods, they by definition have high salt. So try to avoid preserved foods, and thereby the amount of salt intake can be reduced. Exercise is something which has been undoubtedly said to control hypertension. To close to 8 to 10 millimeters of reduction of blood pressure can be achieved. When we talk about exercise, this is becoming challenging with the current situation, because we need to go outdoors, and outdoor going is a problem. And now there is a news which has come just now from tomorrow we are going to have lockdown. But how do we manage ourselves? So if we are at home due to COVID-19 outbreak, where physical activity has become restricted, both because of the government restrictions and also because the inherent fear of exposure to COVID and whatnot. But we have to keep ourselves busy or physically moving. And it is recommended by WHO to maintain physical activity at least 30 minutes by adults and at least 1 hour for children. And this is something which we need to look into and try to find solutions, or how we can get this thing done. And doing any physical activity around house is better than not doing it at all. Getting just stuck to our home and sticking to TVs and not moving because of the fear of getting COVID is something which is bothering. So trying to be active and trying to stay healthy at home is definitely challenging at this time, but where there's a will, there's a way. So if we can look into it, we can definitely find a solution. And not only physical health, but equally the mental health also can be taken care of by being physically and physically active, because again, mental issues are on rise because of the COVID pandemic. So few tips to stay active at home during this outbreak is that try to use whatever which is there at your home. Try to walk up and down the stairs, try to do some stretching exercise at home. If you prefer to dance, try to dance, play with your kids or grandchildren. Do your own household activities like washing your clothes, cleaning your balconies, or whatever. There are multiple daily chores which involves a lot of physical activity, and if we pay attention to in one of our own daily chores, we can find activities where we can make ourselves physically active and thereby our own exercise things. Third issue is about weight management. We need to know about our weight and what is our ideal weight. So body mass index is something which is commonly practiced in clinical practice. This is weight in kilograms divided by height in meters, and you get a number. And these are the standards where if the normal person needs to have a body mass index between 18.5 to 24. Anything which is above is called overweight, and depending on the increase in BMI, the person is classified overweight, obese, or extremely obese. And underweight is also equally problematic, and try to maintain the so-called normal body weight. Stress is on rise in everybody due to various reasons. The fear of getting COVID infection, the fear of if we get COVID infection, the lack of available beds, lack of oxygenation, increasing mortality, when is going to end, a lot of unanswered questions, and a lot of reasons: job insecurity, education is gone bad, finances are gone bad, jobs have gone. A lot of questions in mind, a lot of stress for everyone, every age group, and managing stress is something which is important. And stress obviously has been found to contribute to increasing blood pressure. How to manage stress? No simple answer, but there are multiple things which work. But again, unless we pay attention to and try it out, we can definitely manage our stress better. So meditation, exercise, trying to spend some time in nature, trying to sleep well, connecting socially, eating healthy diet, and prioritizing our list and completing our tasks is something whereby the stress can be reduced. The so-called all the notion on social distancing has been over-exaggerated. I believe it should be more of physical distance and not social distancing. So try to maintain physical distance, but please connect socially. Try to talk to your friends and family and get connected, because socially connecting will definitely reduce your anxiety and you feel good about it. The whole social distancing concept probably I think has overblown, and a lot of people have stopped connecting or stopped talking to their friends and relatives or whatnot, and that by themselves is kind of contributing to anxiety. So please maintain physical distance and connect socially. Do not maintain social distance. Maintain physical distance is what I would say. We did all of those things and still the blood pressure is not under control, then we have to give you or we have to prescribe you medicines. Commonly asked questions: are medicines safe? Or do I need to start this early? And what are my long-term side effects if I start this early? Yes, no medicine is 100% safe, but most of the medicines which are commonly prescribed, they are rigorously tested, laboratory tested, and only after they've been tested, found to be safe and effective, they are being produced in the market. And there are, yes, side effects with every medicine, but they are very, very rare. And if you look at the risk benefit analysis, the risk of getting an organ damage with uncontrolled blood pressure is much, much higher compared to the risk of having side effects. So we need to balance it out. And the suggestion is to take medicines and be consult with your doctor, and whatever is suits you, that needs to be taken. And obviously the benefit of taking medicines far outweighs the risks associated with uncontrolled hypertension. When we talk about meds, also try to avoid unnecessary medication. We have so over-the-counter medications which are available. Common being pain control medications, the so-called ibuprofen, diclofenac, the gels and all which contains painkiller. These are the most common reason for someone to have high blood pressure, or those patients not able to control their blood pressure despite taking their medication properly. These painkillers are very problematic because they not only lead to uncontrolled hypertension, they sometimes can lead to kidney failure, and they can also sometimes contribute to heart failure. So please try to avoid taking these painkillers as much as you can. Try to have some tolerance, and there are safer alternatives to reduce pain like paracetamol or tramadol, etc. Please talk to your physician and take better alternatives which do not produce side effects or harm. The most important thing for adequate control of hypertension is the medication compliance. The other common thing that we encounter is the first visit, blood pressure has been diagnosed, medicines have been prescribed, medicines are being taken for a month or so, the blood pressure is under control, then the medicines are stopped. Presuming that because now blood pressure is under control, my BP has come down to normal and there is no need to take medications. But we need to understand that hypertension is a lifestyle disease. Hypertension, once diagnosed, is there for the rest of the life, and the blood pressure came to control because medications were taken. And if we stop medication, blood pressure is again going to be on rise. And unfortunately, most of the medications are longer acting molecules. So to realize the blood pressure is not being under control, it takes some time. And again, silently, the organ damage occurs and we are missing the bus again. So before we stop medication or before we change medication, please again discuss and be clear about why we are taking and what we are taking. That is where accepting that we are having hypertension and trying to trying to digest the fact that we need to take medications for rest of the life is something which is important, and unless and until that thing has not come up, the managing hypertension will be extremely difficult. And the other thing is about the timing of medications. Some try to take it morning, some try to take it evening, which time to take, when to take, morning, evening, afternoon, etc. Again, many medications right now which are available are kind of longer acting, which means they act for close to 24 hours time frame. So most of the medications which are prescribed, you can take once daily. Try to fix a time which is comfortable to you, like be it morning or afternoon or evening, but try to maintain the same consistency. Like if you are taking it in the evening, make sure that you are going to take every evening. If you want to take it in the afternoon, try to make sure that you are going to take it afternoon. Try to couple it with some activity. Like the reason to advise medications with food is again to tag these two important events like dinner or breakfast or something which are daily activities. And if we tag tablets with them, then we try to ensure the compliance, because these are some of the daily activities. But try to fix one of those timings and try to stick to the same timing daily, whereby the drugs can work efficiently. And finally, blood pressure management is a long-term disease, and it needs constant change and a constant monitoring to make sure that blood pressure is well controlled, and we are monitoring that there is no organ damage occurring or there is no complication occurring. All patients who are having hypertension or who are taking treatment, they need to stay connected with their doctor. These days it is becoming challenging, but equally with all those problems, equally we have innovative solutions, and technology comes handy at this point of time. And most of them have smartphones, and these days internet is easy. Just like we are connecting now virtually, discussing about hypertension management, equally the consultations are becoming easy, and most of the doctors are right now comfortable doing video consultations, and it's a phone call away. So use these facilities and stay connected with doctor. Need not be physical, but trying to be connected with the doctor and know about the status, and when needed, definitely we can do a physical connection if needed. But most of the problems can be managed virtually without physically meeting, and we can still get the things done. So this is what I wanted to talk about hypertension. So thank you for the hearing me, and if there are any questions or anything, I would be happy to answer your questions. So over to the moderators.
Yeah. Thank you, sir. That was really wonderful, and it's definitely going to be very helpful to all of us what you have given your insights on. So any of the audience would like to ask any questions? You can also, okay, we are having somebody who has raised their hand. Yes, please. I'm going to unmute you, or you can text.
Yeah, a few of them who want to question or talk directly equally can be done, or equally please post your questions in chat box where I can read out and answer your questions. That way we can.
I have given the option for the participants to unmute themselves. If you have any question, you can unmute and ask also, or text.
I can see Mr. Prasad. Yes, yes.
Yeah, good afternoon, sir. Your explanation is excellent. And you told that we have to take 3 readings to test our blood pressure. And I want to know what is the right time to check our blood pressure, whether early morning or afternoon or after lunch, somewhat like that. And another question is, you told that 120/80, this is the standard reading that we should have below this particular one. But somebody is saying that in these days where we are working on our toes, definitely there will be some work pressure, and because of that some upper readings may record it, but it can be ignorable. Is it correct? Kindly please clear these 2 doubts. Thank you very much, sir.
Yeah, so let me answer your first question about what time is the right time to measure blood pressure. So blood pressure is something which is there 24 by 7, and there is no particular time that we need to check blood pressure. And we advise patients who are monitoring their blood pressure at home to make multiple readings at multiple times. Sometimes in the morning, sometimes in the night, sometimes in the evening, so that we know so-called 24 hours, whatever we can mimic, time to know about the blood pressure readings. Few things to pay attention is try to uh, pay attention about the so-called activity and all those things, like taking tea or coffee, taking a heavy meal, or having some pain or some discomfort. All these situations, or there are multiple reasons which can lead to a increase in blood pressure. So we need to try to eliminate these confounding factors which can lead to an elevation in blood pressure. So thereby we want to relax. There are other external sources that have been eliminated in the form of things which I mentioned, and we take multiple readings so that we are averaging it out. So suggestion would be to take multiple readings at multiple occasions and take an average of the readings. So not one thing or one reading or one time is recommended. Multiple readings are to be recommended. The second question that you mentioned about blood pressure being high these days and these times, and the blood pressure being high is okay, is not something which I do not accept. Yes, situations or things have changed, which is one of the reasons why most of the patients end up having hypertension during these time, because of lack of physical activity. Most of them are working from home, and because we are working, there is binge eating, there is inadequate physical activity, there is also stress due to COVID, and there are multiple reasons why we could have high blood pressure. But that high blood pressure again is not something which is accepted. What are we doing to this blood pressure is something that we need to pay attention, because if this is only a temporary phenomenon where because of this change of lifestyle we are having blood pressure, do we need to start taking treatment or not is the question. For someone who is having hypertension, obviously treatment needs to be modified. And for someone who just got detected to be having hypertension because of these things, again try to eliminate these things or adopt lifestyle medication, lifestyle measures whereby you can control the hypertension and we can avoid taking medications. But the numbers being high, is it normal? No, it is not accepted. It is not normal. What are we doing to it is something which is debatable.
So, sir, one question from my end. So, it is like a common
Yeah.
persons who is having a low BP, they'll get this blackout. Is it because of BP being low or some other conditions, sir? Blackout. It's like
Blackout,
they are getting.
blackout is a common symptom which most of the time is in relation to low BP. Like people who are the common scenario which we see for persons who are blackout is in elderly hypertensives, where they are taking BP medication and after lying down position, suddenly they get up either to go to washroom or from there they get up in the morning after lying down in the late night. Because of assuming that standing position, there can be a sudden drop in blood pressure. During that sudden drop in blood pressure, they can have a blackout, and they might sometimes even fall down because of that blackout, depending on the severity of the drop in blood pressure. And it is a temporary phenomenon, because after they fall down or after they adjust, the blood pressure again picks up and the scenario becomes normal. So for that to happen, there is a significant drop in blood pressure. As I mentioned first time, the blood pressure can drop less than 90 systolic and less than 60 systolic. These are the situations. Because of the drop, they can have a blackout. But that reading again, we do not consider as a hypertension or something. So any hypertension, we need to not react based on one reading. It's a multiple readings and an average blood pressure measurement that has to be taken into consideration and acted upon.
One more question from the audience. It is asked, it's Tanmay. She's asking, is 130/90 okay for a person with hypertension?
No. So if the person has hypertension and if his blood pressure is 130/90, then his hypertension is not being adequately controlled. He needs his medication to be adjusted until the blood pressure is less than 120 and less than 80.
Tanmay, is your question answered?
Yes, ma'am. Thank you, sir. Thank you so much.
Okay, if you have anybody else who has any questions. One question from my end, sir. You said only 2 grams of salt per day is advisable, and we come across so many advertisements saying that Himalayan salt is good, or maybe the pink salt, some pink salt is good. Is there a facility that we can change or shift to that type of salts and increase a little salt in the diet?
I like the question that you asked. So when we talk about salt, the most important thing that we look into is the amount of sodium content in the salt. Salts which are currently being popularized, the Himalayan salt and pink salt and all, they have additional minerals or additional salts, so to speak, to add to the taste or flavor or whatever we saw. But the most important thing is this sodium content. And if we look at the total sodium content, then all the salts will be the same, be it Himalayan salt or the rock salt or the normal salt or whatever. So in that aspect, the amount of sodium content will be same. So reduction of salt intake will be the same thing in relation to all the salts this has been mentioned. There is another variety of salt which is available, that is so-called LONA salts, that is low sodium salts, where these salts, their sodium content is reduced and they are essentially replaced with potassium salts, where the taste will still be the same salty taste, where the sodium content is less. In them, the amount of salt content probably can be reasonably okay, because what we are looking at is amount of sodium that we are consuming and not salt in particular. So I hope that answers your question.
Okay, thank you, doctor. And one question that has been text to my mobile. The question is that the student says that she is getting cramps in the stomach. Is that a sign of hypertension, especially when she is tensed? She feels cramps in her stomach.
No. So abdominal cramps and hypertension are not related. Abdominal cramps are something which is different and hypertension is different. The problem that happens with hypertension is whenever we have a problem, like whenever we are stressed, whenever we are anxious, when we have pain, when we are angry, when we have headache, that is the time the blood pressure is being measured, and that is the time where blood pressure obviously will be high, because body reacts to pain. And whenever there is pain, whenever there is headache, whenever there is anxiety, BP obviously will be high. And measuring blood pressure at that point of time is wrong. Most of the people do measure blood pressure when they feel abnormal and tend to understand, tend to accept that they have hypertension and believe that it is hypertension, which is wrong. Blood pressure is something which is where there is no other confounding factors where the blood pressure can be elevated. We eliminated all these things like this pain, stress, and whatnot. We did everything where blood pressure should not be elevated, and even then, if the blood pressure is elevated, that is what is hypertension. So checking blood pressure when we are having abdominal cramps is something which should not be done. And if we do and notice the blood pressure to be high, that again should not be interpreted as having hypertension.
I hope the question has been answered. Any more questions from the audience?
Can we compensate
prevailing in the current scenario is like type of oil being used at home. Okay, so which kind of oil that you recommend? Is it groundnut oil or is it sunflower oil? Because most of the people say that due to this heart condition and everything, we should go for certain kind of oil. So your recommendation on this, sir?
Yeah, so oils and heart diseases is something which is again a commonly asked question. So the most important thing is not about what type of oil that we are taking, but how much oil we are taking. It's all about quantity of oil consumption than the quality of oil consumption. So first thing is, please pay attention to how much oil are we taking. Any oil, even if it is olive oil for that matter, if taken in excess, leads to heart problems. Then if oil content has been restricted, the next question is about which oil to take. Most of the vegetable oils are said to be good to heart. So all those saturated fats like dalda, vanaspati, etc. are bad. Those are all to be avoided. Most of them are not using it. Thanks. But all the vegetable oils are equally good. Among them, the most commonly used oil, which are again rated according to the heart healthiness, is something called olive oil is said to be the best. But for Indian setting of cooking utensils, olive oil is something which may not be suitable to do the so-called Indian type of regular cooking. Something which can be used, which is said to be good, is the canola oil. It is a bit expensive, but that is something which can be used in the day-to-day Indian practice of cooking and all those things. Moving down the list is the sunflower oil and rice bran oil are said to be a bit heart healthy, and followed by peanut oil and the mustard oil, etc. Most of the oils or most of the vegetable oils are okay, and I re-emphasize the same thing. It all depends on the amount of oil that we take, and each and every oil has some advantage here and there. It is for the same reason it is recommended that we keep changing oils. Like for 1 month, if we have used sunflower oil, it is preferable to use rice bran oil, and next month again we change it to peanut oil or something, where the advantage of all the oils are being taken into consideration.
Thank you, sir.
Yeah.
We have some questions in the chat box. We have Hepzibah ma'am asking, can we drink warm water in the morning with salt? Does it help in controlling hypertension?
So first question about this warm water with salt is something which is quite popular nowadays because of the COVID thing, which is being popularized, that COVID virus going through the nasal airways and airways. So washing away with warm water and salt is something which is recommended, but most of them do. First thing we need to know is why do we want to do? If by drinking warm water with salt, we are trying to eliminate COVID or not trying to get, that is incorrect. We are not able to stop it. It anyway, it's going to come. Second thing, we just want to make feel fresh, or it's something like mouthwash kind of a thing which we want to do. Salt being good antibacterial kind of a thing to eliminate all the pathogens or those bad smell producing things in thing. Yes, we can do. Regarding any relation or association with hypertension, no. So drinking warm water with salt probably is not going to control hypertension, and it again depends on salt content. As long as you are gargling and you are throwing it out, that again should not lead to salt consumption, and it may not equally contribute to hypertension. So before we do these things, we need to know why we are doing and what we are trying to achieve out of it. This is my take on that question. I hope that answers the question.
I think Madam has been answered the question. And the next question is from Dr. Priya Madam. And she's asking, can a heart patient with multiple stents take any other medicine during, like if they are being getting some cold, common cold or fever? In her family, she has one person who has multiple stents, and they're always scared to take any other medicine. So what is your suggestion on it is her question.
So first question, for a patient who has a heart problem who underwent angioplasty with multiple stents, they need to be on set medications for those stents to work fine and not to have a heart attack or something. So those medications which are prescribed by your cardiologist Unless warranted, please do not stop those medications. When we have a second problem like a common cold or fever or headache or other things, and when we need to take medications, and then we can take medications provided we check with again the cardiologist about the safety of those medications. The common problem that we try to have, or what we try to look at, is the painkillers. Most of the patients who have pain or fever, they are prescribed these strong painkillers which work very well. The pain is gone, but equally with the cost of producing heart failure or kidney failure, which as a cardiologist, which we are feared for. The other thing is again taking steroids, which are again over the counter, and some of the quacks prescribe those steroids, which equally are harmful to heart. So can we take additional medicines? Definitely we can take additional medicines for the new problem that arises, provided we know that they are friendly to heart and they are not going to do harm. So if in doubt, always try to check with your cardiologist or your physician about the safety of those medications. But at any point, please do not stop the previous medications which were taken, and this new medication which are being taken to deal with the problem, take them for a shorter duration until the problem is rectified, and then stop it.
I think that question has been answered. And now we have Geeta Devi asking, will intake of caffeine affect the blood pressure?
Yes, caffeine consumption leads to increase in blood pressure. That is where patients who take tea, coffee, or caffeinated beverages, they are not supposed to check their blood pressure immediately. Take at least 30 minutes of gap or longer if possible, and then measure your blood pressure, because caffeine can lead to increase in blood pressure.
There's one more question from the students. They're asking what are the masks that they have to be using during this pandemic?
So, so depending on, again, not probably relevant to the topic, but I'll answer this question. Depends on what situation you are in. Like for a regular use or commuting purpose or etc., the surgical mask, which right now I am wearing, something which is good enough, which has about 3 layers, is comfortable, breathing is easy, and it kind of filters most of the viral particles and does the job, and quite economical and easily available. The so-called cloth masks are something which are quite commonly used. They are reasonably okay, but not 100% effective in filtering all the virus particles. So be aware that by wearing cloth masks, you still have the risk of getting infected. So try to maintain physical distance while you are using only the so-called cloth mask. Probably okay if you are taking surgical mask, but when we are actually in the high risk zone where we are dealing COVID patients, or when you are in direct contact with some patients, then even these so-called surgical masks are also not sufficient, which is where we need more than that. That is the so-called N95 mask, or sometimes using respirators. Easiest thing to do because of discomfort. Most of the patients may not be able to tolerate N95 mask because it kind of gives you that suffocated feeling. The easy solution would be to try to do double barrier kind of a thing, where you can probably put a cloth mask which is comfortable to you, and try to put a shield, the so-called plastic shields or those helmets which are available. Thereby you can kind of eliminate the risk of infection. That is what practically I would say. Or you can use the so-called surgical mask if possible, and if you can get it, which are kind of does the job with a single purpose.
There's one more question. This is, I think, one of the student is asking, can high use of salt or sodium neutralized with any other food items? Maybe any vegetable, or maybe.
So when we talk about salt and neutralizing, the two things that we need to pay attention is, one, about the amount of sodium that is being entering the body, and second thing is the taste or the salty taste that we are talking. So the neutralization of the salty taste can be done by additional food items where the salty sensation or the salty taste can be neutralized. But because we do take the food, the amount of sodium that enters the body cannot be controlled or neutralized. So that cannot be neutralized. So the only thing that we are neutralizing is actually the taste of the food, not tasting too salty or making it more palatable. And we are not actually neutralizing the amount of sodium entering the body.
One message.
Thank you, sir. Shridevi ma'am, I don't see any more questions, new questions coming in.
Just one last question, I think.
Sure.
Already answered, but still, this is in relation to cardiac patients. Which type of oil do you suggest? Is the question. You have already answered it as olive oil. The question is like to the cardiac patients, in relevance to the cardiac patients.
It's more or less the same thing. So for cardiac patients, we tend to be in general more precautious. We check their cholesterol levels and we try to give them a specific diet plan to try to consume. But in general, most of the points which I already mentioned, they do apply to them as
well. I think all the questions have been answered.
Yeah. So let me close the session, Shridevi ji. With this, on behalf of Dr. Reddy's, I thank our speaker and all the participants for taking your valuable time out. I wish your day is filled with positivity and good health, because at Dr. Reddy's, we believe in good health can't wait. Thank you, sir. Thank you very much for your session.
Yes, sir. Thank you from on behalf of VJIT also, and your valuable advice is definitely like an ounce of prevention is worth a pound of cure. So I wish all the participants eat healthy, stay active, and try to minimize stress. Stay safe, stay healthy. Thank you very much, Dr. Praneeth, for your valuable message on how to maintain a healthy heart. Thank you for your valuable time you shared with us. Thank you, sir.
Yeah, thank you so much. I hope I could give some information to all of you, and I'm happy to be associated with you. And thank you one and all for your attention and